Respected Dr. R.P. Mishra, Dr. R.K. Mishra, Dr. Ajay Diwan, Mr. Atri, and friends. It's a great honor to stand here this morning and talk to you. I bring you greetings from several organizations, greetings from Association of Surgeons of India, greetings from International College of Surgeons Indian section, and also greetings from College of Surgeons of India to all of you this morning. I'm very happy that somebody has taken the lead in familiarizing technology. My association with Escorts Group of Hospital, we introduced robotic in 1995, and first robot that we brought in was ESOPs. At that time, everybody was saying that it is the boy's tool because it only used to do very few things. You use it at a retractor. It was voice activated. You say activate, retract, it will retract. You say relax, it will relax. Very limited application. But we realized that technology has to move in the operating room. We were one of the first, a group of 5 hospitals in the world that we introduced Da Vinci, and we carried out first robotic totally bypass surgery at Escorts, and that was in 2005. Our experience with robotics goes long time back. Robotic is natural extension of laparoscopic surgery in the area that we can't access easily. When you do laparoscopic surgery, all of you realize that there are technical problems in laparoscopy, and that is how far you can move, how well you can see. And this change is inevitable, and it is walking into the operating room. I'm very thankful to Dr. Mishra that he has started this institute, brought in the robo so that all of us can get exposure on this technology. It has moved away from being available in very few centers to now being available to all of us to see how it works. I'm very thankful for Dr. Ajay Diwan to briefly peeping into the future. However, the future is here. And believe me, in time to come, which may not be very long future, most of us are going to be unemployed as far as surgery is concerned. I remember my days in UK when I was under training, and one of the most major emergency that we coped with was leaking aortic aneurysm. These days we don't open patient for leaking aortic aneurysm. You look at the history of bypass surgery. Now most of the cases has passed on to interventional cardiologist. However, this is not future. One of the most atraumatic surgeons amongst us are eye surgeons. And when they use even FICO, they are damaging trillions of cells. And so remember how much cells we will be damaging when we are doing laparoscopic surgery or open surgery or even robotics. In 25 years' time, when the new generation of surgeons will look upon us, perhaps they will think that we are as barbaric as perhaps John Hunter was in 1850. You know, he used to steal bodies from the grave, dissect and display in London. So we have moved very far away from there. Our teacher used to say that the big surgeon makes big incision. Now we are saying the small incision is the future. In a small town of Greifswald in Germany, they realized that the cost of curative surgery or curative medicine is too high. They have an aging population, and 7 years back they started a study called SIP study. The first phase of the study was SIP1, and what they did was a total molecular mapping of the whole population. And what they intend doing in SIP2, they are following up with second molecular mapping, where they want to pick up the deviation in the molecular structure, as Dr. Ajay Diwan said, in the cells, and treat it at that stage. Future, as we saw from Dr. Diwan's presentation, is knocking our door. You don't think that this is very future. It is very much here. You think of MEMS that Dr. Saab was talking about. You look at the car, you look at the balloons we have in the car to protect yourself in crash. that used to be based on mechanical devices used to cost $100. Now you look at these air balloons. They are based on MEMS principle. They cost $5, $6. They are mass produced. And now most of the good cars have them. So this technology is much nearer that many of us thinks. People like Diwan, Dr. Diwan, they go out of way to bring it to us so that we can get acquainted. And I'm very thankful to him for enlightening all of you on what is going to look like in the future. However, I would like you to also remind of our duty as a physician, as a healer, and it will be wrong for me to let you go with the message that we have to move away from the patients. I remember quotation from Anthony Broyard. He was the editor of New York Times Journal, and he had the prostatic cancer. He was lying in Boston in one of the most premier hospital, and the article he wrote was, "Doctor, please talk to me." Many of us, we think that when we are taking the round in intensive care unit, the patient is not a person, it's an object. You have to think of the relative who are standing outside. In virtual every hole or non-hole you have put in a tube. We have to start thinking of humanizing our practice. We have to, many a time you find that the residents don't even care when they stick the needle to a patient in ICU. They have a chest tube, invariably they have a Ryle's tube, they have a tube in their urinary bladder. We may have some arterial catheter, may have venous catheter. However, what we forget that what we are practicing. And it's very, very important as a surgeon that we, apart from introducing robotics, apart from being new technology, we remain relevant to the practice that we are by training healer and not the fixer. So please never forget that to remain relevant in the society, relevant to the patient, different from the robotics, so that we remain in practice, it is very important that we remain a healer and not a fixer of a disease. There are many circumstances where we think that we have nothing to offer. And what happens at that stage? Most of us will abandon those patients in the sense that once we realize that the disease is not curable, please always remember there is another relationship that you have with the patient. And that is to sit down and have a chat with him. Think of what is going to happen to him. Empathize with him. And that is very relevant, very important in the changing scenario of the technology. Because I remember Bernie Lawn. Bernie Lawn was cardiologist at Boston, and he was awarded Nobel Prize for his work, not in cardiology. His work was that how doctors should remain healer and should not be lost in obscenity of technology, that he calls. You know, I am reminded of George Soros. George Soros started his fund, and he became immensely rich. He was from Hungary in Budapest, and when he left Hungary, his father stole him from onslaught from the Hitler that was taking place. And he found that that regime was very barbaric. And after that, Russian came. And he noticed that they were equally barbaric. So any act that we perform, we think that we are doing the right thing. Whether it is right thing or not is to be decided by the future generation. What George Soros thought, that when Hitler can be so wrong, and so wrong can be Russians, so a lot of people investing in the funds in the future, they can be also wrong. And if you can get hold of that opportunity where they are wrong, then you can become rich. And that is how the hedge fund came. Why I am telling you this story, that his father spent everything to escape from Hungary, and they finally got to England. And George Soros got educated in London School of Economics and migrated to New York. And when he died, his father died, George Soros has one big problem, that he couldn't share emotional bonding with his father, he couldn't repay his debt, and now he has started a huge fund on how to look after the terminal patient. That fund is totally devoted on work on how to look after terminally sick patient. And I bring you back to present scenario that we should not forget that that is our responsibility. I am not going to keep you away and keep on talking, but as Dr. Ajay Diwan has said, as Vimal has described, the surgery is two acts that we do. One we see, and the second thing what we do with hand. And whatever future is going to be developed around these two things. Future is perhaps nanotechnology, which is at very high level of development now. They say that if you are going to live 30 years, you may live 300 years, because the new technology will keep you alive. However, I am not very sure that what kind of ethical and moral issues this will raise. And have wonderful time here. I am thankful to Dr. R.K. Mishra, Dr. R.P. Mishra, Mr. Atri, all of you to invite me here, give me this opportunity to talk to you. I am sorry I have not brought any formal presentation, but a lot of greetings and warm wishes. Thank you.
Thank you very much, sir.